glad you chose this subject of cervical cancer. And we're having this discussion just 2 months down the line after the celebration of the cervical cancer awareness week. It is important that we have this discussion because cervical cancer is a big public health problem globally, but more so in low-middle-income countries. But within even the low-middle-income countries, again, the inequities and disparities again exist. That it afflicts more the poor, the marginalized communities, and those who live in underserved communities. And that is why, if you start talking about cervical cancer, probably in one of the sub-counties, say Marsabit or Wajir or whichever county, people will say that goes to the public, that you get the correct information to the public so that together we can be able to make progress. We know in Kenya, cervical cancer is the second commonest cancer after breast cancer. But in terms of mortality, it's the leading cause of cervical death due to cancer. Yearly, we report, according to 2022 data, 3,900 deaths. That is about 10 women dying every day of cervical cancer. And as one of the journalists here remarked earlier when I was having lunch, if this was affecting men, probably by now would have had a permanent solution. And if you look at the direction that we have tried to take as a government, and then I'll talk to it, is a shift from curative to preventive and promotive health services. Following the enactment, the Primary Health Care Act, for the first time, is anchored in law and is supposed to be fully funded by the exchequer to the tune of about 40 billion Kenya shillings as the initial investment. Why have we taken that shift? Is because the burden of non-communicable diseases, including cancers, is on the rise. You see the struggle we are going through with our health workforce. We are not going to have sufficient numbers, not in the foreseeable future, as also our population continues to rise. Indeed, the WHO says that by 2030, we'll have a shortfall of 10 million healthcare workers globally, and nearly 50% of that deficit will be in sub-Saharan Africa. And therefore, if that is the direction to go, then we have to take a futuristic view and see what will be able to serve us best. That is why we have taken that fundamental shift from curative to preventive and promotive, placing health and well-being squarely at the household level and the individual level. That the information of cancer, cervical cancer screening, and to go for treatment. And I want to correct this. Kenya actually piloted the HPV vaccine in Kitui County in 2019, and HPV vaccine is available free of charge in all public health facilities. You don't pay a single cent. We have 3 classes of vaccines as a country. We have what we call the traditional vaccines that we procure 100%. That is like measles, BCG, rubella, tetanus, and polio. That one the government of Kenya pays religiously without default. Then we have the new and underutilized vaccines. You know, when you bring a new vaccine, you have to be able to sell that idea to the people that it's important to get this vaccine. And this is the dividend that is going to accrue out of you taking that vaccine. HPV for